Do you have migraine headaches? Do you have tension headaches? Has the medication you're currently taking, does it just not seem to work anymore or not work very well? How about this one? Has your doctor said you just need to learn to live with this? Well, if that sounds like you, I have some exciting information to share with you that could literally change your life. Hi, my name is Dr. Griffin. I've helped literally hundreds of people with headaches, migraine headaches, over my 25 years in practice. I've actually performed over 25,000 chiropractic treatments. Now, the thing is, there's about 25 different types of headaches that we see. Everything from migraines to viral headaches to tension headaches, cluster headaches. So today I'm just going to kind of focus on the two main types of headaches that we see, and that is migraine headaches and tension headaches. And so we want to talk a few minutes about what the differences are with those. There's some similarities, but like with migraine headaches are usually unilateral, meaning one side of the head is usually where the headache is, and it's usually a very pounding type of headache, and I'll tell you why that happens in a minute. Also, people with migraine headaches, they tend to have visual disturbances, anywhere from a few minutes to a few hours before their headaches. They'll actually start having floaters in their eyes or squiggly lines, and they actually see an aura about different objects. Also, people with migraine headaches, they suffer more with activity. In other words, those are the type of people that, gosh, just get me in a room, close the curtains, shut off all the lights, put the kids away, and just sleep it off. They're usually very, very painful if you've ever had those. Now, the difference with a tension headache, it's slightly different. A tension headache is usually bilateral, meaning both sides of the head, usually can start in the back or in the temples, and that's more of a pressure type headache, where just this constant pressure, but you can do activities, you can go about your business, and it doesn't bother you as much. Also with tension headaches is there's usually no visual disturbances. So let's talk just for a few minutes about what causes these headaches. And to do that, I want to give you a little bit of a quick class on spinal anatomy. If you've ever had any anatomy in high school, you'll know that the spine is supposed to be straight, right? Now, what people tend to forget or don't realize is the spine from the side actually has curves in it. And the most important curve is this C-shaped curve in the neck. That's very, very important. Also, did you ever think about this? If you bend your head or twist, the head and neck always come back to the same position. Ever wonder why that is? That happens because of, this is a little picture of your brain here. This is a side cutaway. And what controls all your spinal muscles, your posture, and the ability to move your spine and it always come back into the same direction, in the same shape, is this little part of the brain back here called the cerebellum. That's very important. You'll see in a minute in people that suffer with headaches. So, the point with all this is, what we have found is that in over 89% of the people with either migraines or tension headaches, they don't have this curve anymore. They've completely lost this curve. Now, here's what it does. With a tension headache, when you lose this curve, there's actually nerves right behind the back of your skull, the first and second cervical nerves. They become stretched. They become irritated. Those nerves go up around the back of the skull. This is just a cutaway. They go back up, and they control all the muscles of the scalp and blood vessels of the scalp. And when those nerves are being irritated, it hurts. And that's where we find this straightening of the cervical curve causes a lot of those tension headaches, and also the neck pain, the severe nagging pain that's right at the base of the skull. It's because of the pressure on those nerves and those muscles there. Now, slightly different with a migraine. When you lose this normal cervical curve, you can have those things, but usually what happens is the cerebellum. Now, remember I told you about the cerebellum. That controlling all the spinal muscles, the other thing it does is it's kind of a check and balance for the top part of your brain stem. That's called the mesencephalon, big neurological term. But those two have to work closely together. When you lose the cervical curve, the nerve input to the cerebellum is reduced. So when that happens, the cerebellum literally overfires. And when it overfires, it causes an irritation to the nerves that are actually in the brain and the neurons. They control the blood vessels. So you have this dilation of the blood vessels, then you have a contraction of the blood vessels. And that's where you get that severe pounding sensation, is those blood vessels opening and closing. But in either way, some similarities, but they're both, we find in over 89% of the cases, both the migraines and both the tension headaches are from this loss of the cervical curve. So here's my question to you. If 89% of the people with migraine and tension headaches have a loss of the normal cervical curve, then how many pills, how many drugs, how much Emerex is it going to take to restore the normal cervical curve? Obviously, drugs are not meant to do that. Okay, so it's just not going to happen. So let's talk a minute, just for a quick minute, about what we do that's different and how we go about helping people with migraines. There's actually 5 different areas. First of all, I want to tell you what my job is. My job in helping you is, number one, to treat you as a person and not treat your diagnosis or your labels. Labels are for food, cans of food, they're not for people, okay? So, in fact, that's why you've been suffering for so long, is you go in and your doctor looks at a big, long list of drugs that are made to treat headaches, and hopefully he'll find one that reduces the symptoms a little bit. But that's not really getting at the underlying cause, and that's more what we're about. So the other thing we want to do is we want to check over your brain very thoroughly. Your brain literally controls every cell, every tissue in your body, and it has to work right, okay? 2 things that we look at is fuel and activation. Now, the fuel comes from the food you eat, okay? The food you eat turns into glucose. That glucose attracts oxygen, and those actually create the energy your brain needs to run and for you to be healthy. The other thing your brain needs is activation, okay? Activation coming from the environment. Every time you move your body, every time you move your arms, those nerve signals go up to that cerebellum and allow it to be healthy. That's why you need a healthy spine. So we take a look at fuel, we take a look at activation, we see how those are working. The other area we need to address is we need to find out, pinpoint exactly where the trouble is with the neurological exam. And we may even need to do blood work. Some people, we need to take a look at your blood work. There may be metabolic problems going on that we need to address as well. So I just want to tell you, we get phenomenal results with people that have had migraine headaches, tension headaches, other types of headaches. And we do this because we leave no stone unturned in trying to help people. The other thing is, I don't accept everybody. I only accept those people I truly believe I can help. So what's your next step? Well, if you would like to have 2 free visits in our clinic, fill out this form here, and we'll get back to you as soon as possible. Now, why would I give you 2 free visits? Remember I said I only accept those people I really feel I can help? So you can come in here, and I don't want you spending a lot of money only to find out I can't help you. So you can come in, and basically it's on me, and we will do everything in our power to see if we can help you. Okay, so thanks, and have a great day.